5-minute therapy and to thriving in your body. I am Monica, and as you know or may not know, I've been a myofascial release therapist for many years, over a decade, and helping people with um, overcoming chronic pain, but also helping you thrive in your body and connect you with most innovative health solutions out there. So I am here today to talk about, pretty briefly, even though it's a huge subject, I'm going to be talking about surgeries and scar tissue. Because, I see many clients every day in my practice, many women and men, and they come in and, complain from pain, discomfort, tightness, soreness in their body. Maybe they have reduced mobility. And the question we always asking, not what the symptom is, but what are the causes? And in my practice for many years, what I found out that many times, I would say even majority of those causes have a link to surgery or scar tissue that has been created in the body as result of a surgery or another similar accident, similar trauma, so to say. When we talk about surgeries, we all know it's a big event. Sometimes we really need to undergo a surgery. It's absolutely important. It can be life-saving. And I have many, many, many clients who have had life-saving surgeries performed. And that was a huge thing for them. It was absolutely necessary and important. However, they never been told that after the surgery, the healing process is not over. The healing process begins. The body needs to restore itself from the trauma of being cut with a surgical knife. It has to restore itself from the trauma of being disformed, of scar tissue that had to accumulate around the incision, but also within the body. If, for example, a woman had hysterectomy or a C-section, it is a deep-reaching scar tissue that creates kind of tight, constricted, ropey areas in the connective tissue, in the fascial system, and then can press on organs. In this case, because we're talking about pelvic surgeries, on the organs that are accommodated within the pelvic floor. But that goes for anybody and anything. If you had a knee replacement or a shoulder surgery, if you had a neck surgery, anywhere in the body, the scar reaches deep into the body. It's not just the surface on your skin. And all too often, all we think about is how is that scar looking on the skin. I've watched a fascinating video where the fascia has been photographed and magnified over 25 times. And it was about scar tissues and how the scar tissue looks underneath the surface. Underneath that skin surface, they can look okay. They can look like it's been healed. But underneath, there may be inflammation. There may be thick, ropey tissue that's impinging or making it difficult for the body to move. And it may be pressing, creating pressure, excessive load on your nerves, on your joints, on blood vessels, and on neuroceptors, on pain receiving structures within the body. And we become unhealthy, so to say, in general. We start to have pain, we start to have reduced mobility, and we're wondering, like, why is this happening? Because sometimes it's so hard to make that link between the surgery, between that event, and between the scar tissue and what is happening next. Sometimes, and I've seen that many times, my patients would have a spinal surgery that really made a huge positive difference in how they felt. Maybe it was a surgery that helped take off some pressure off the nerve in the back and alleviate the symptoms of sciatica or that shooting pain down your legs. And that was a lifesaver. It was huge. But what happened and what now starts to happen after, say, maybe 5 months or 2 years, the pain keeps on coming back. And oftentimes it keeps coming back with a vengeance. It actually becomes more exaggerated. And this is so puzzling. It's so frustrating because we went through this event, surgery. It was a big deal. There was a lot of hope around it. And yet, the pain comes back. So what we're looking into is what the surgery did to the body by creating the scar tissue. And then once we can unravel the scar tissue, we can start asking questions of what were the causes from the start of that spine dysfunction, for example, back pain, or any other similar situation, your neck pain, your shoulder pain, etc. So what we do as myofascial release therapists very often ask our clients or patients, have you had a surgery? Have you had, try to remember, it doesn't mean that it was, it doesn't matter that it was a surgery 2 years ago. Maybe you've had one 20 or 30 years ago. And we look for scar tissue on the body. And even for those little small incisions that come from your laparoscopic or arthroscopic surgeries that seem really teeny and small on the surface. But again, imagine there was a camera and a surgical knife going into the body as through the tunnel all the way down into the organ that maybe was removed, or any other repair done around that organ. So there is a big tunnel of scar tissue and tightness and constriction that goes through the body. And over time, the body doesn't stop. It actually creates more and more restriction around the scar to make sure that everything is secure. Our body has this mechanism, this protective mechanism of making sure that everything is okay and everything is secure in place, because we need to protect our life, right? So what happens is that we build more and more of that scar tissue, and over time, over the years after surgery, that scar tissue becomes even thicker and vaster, and it kind of grows into the body as vine, as if it was a vine. And what we do when you come in for treatment, we start to just simply, gently, with no force, release that scar tissue. And I'm talking about it, I'm not talking about it scientifically, but I'm talking about it in a way that maybe you start to feel and imagine what that scar tissue can do to you in your body. So it is important, if you have a therapist, if you already are receiving therapy, I would encourage you to actually ask your therapist to treat your scars and talk to them about your surgeries, and talk to them about where you may have scar tissue in your body, and encourage them to use gentle techniques to release it. But you also can start on your own. For example, for women who had C-sections, which is such a common surgery, I'm going to show you here on my body, you got this line of scar tissue created underneath your belly, right above the pubic bone, right? And so it often can lead to pain in the back. It can lead to pain in the hips. So what we do simply with myofascial release, and this is something you can do yourself, you use your fingers, and you can put your fingers together, and always remember to be very gentle. And you simply put your fingers together. You can put them this way or just one hand, but it's good to use both hands together for support. And you basically touching with the tips of your fingers, touching that scar, that incision, and putting gentle pressure. And you want to be laying down during that process. You may have, say, for example, if it's a scar on your belly, you may have your legs bent for a little more slack. And then you just kind of putting a bit of pressure, connecting, breathing, and allowing your fingers to sort of start to sink in into the tissue. You're not rubbing, you're not massaging, right? You're not moving. you're just putting gentle, sustained pressure and waiting. So you can do it on your belly. Let me show you. So I'm just gonna, put my fingers right here and just, I can sort of even fold over. I'm not laying down. So I'm just putting that pressure, and I want to stay there for at least 5 minutes, right? So it is important that you be very gentle with your fingers. Don't press too hard. If you start feeling pain in your fingers, that is too much. So this is a technique that you can use on any part of the body where you can access. If there is a laparoscopic surgery, you can actually put your finger on that scar because it's going to be a little dot. So you may have that dot. It sometimes actually is hiding in your belly button as well. So you're just putting your finger on that dot and doing the same process gently, without forcing, without straining your finger. You're just putting some pressure and waiting for the tissue to pull you in. And what you'll find, which is sort of like magical with the scar tissue, is that your finger will start to sort of melt into the tissue, and kind of as if you were sinking into a warm sand or a wet sand, and you're being pulled in and just gently following the body. So ask me questions if you want to know more about this technique. I encourage you to just start treating your body without force, waiting for everything for at least 5 minutes. Okay, so reach out, tell me if that was helpful, and if you have more questions about how to treat your scar tissue and when is it safe and when it is not. Okay, I'll come back and talk with you more, and let's keep on going. And every day, I encourage you to spend at least 5 minutes treating yourself on the ball and watch other videos to know how to do it, or with your hands or fingers. Okay, have a beautiful rest of the weekend, and we'll talk soon. Bye bye.